In 2026, we were supposed to be living in the golden age of medicine. Next-generation cancer immunotherapy, new drugs that dramatically alleviate obesity, and precise AI-based diagnosis. Humanity has acquired unprecedented weapons and is on the verge of conquering all diseases. Or so everyone believed. However, reality has presented a cruel reality that betrays those expectations. In January 2026, a recent American study reported by the medical media outlet Stat shocked the world. Despite such advances in medicine and the continuous emergence of groundbreaking new drugs, our heart health, especially among younger generations, has deteriorated to its worst level in decades. Why? Despite the increase in medications, disease is not decreasing. Why are young people's hearts silently crying out for help? Today, we delve into the inconvenient truth of a public health blind spot hidden in the light of cutting-edge medicine. The most worrying aspect of this report is the sharp rise in cardiovascular disease risk among those in their 30s and 40s, the prime working age. The underlying cause is the inadequate management of so-called lifestyle-related diseases, high blood pressure, diabetes, and obesity. You might think that's something that's been said for ages. However, the problem is that the quality has changed. These were once diseases of middle-aged and elderly people. But now, there's a dramatic increase in cases among younger generations where blood pressure and blood sugar levels have reached levels requiring treatment, yet are not being properly controlled. According to the latest data, younger generations are more likely to be optimistic about their health, fail to continue treatment, or overlook early warning signs. Even when new drugs are developed, the heart and blood vessels suffer irreparable damage before they can reap the benefits. Why does this happen in an era where medicine is so readily accessible? Experts point out that there is a psychological trap brought about by the progress of medicine itself hidden there. For example, the emergence of groundbreaking obesity treatments like GLP-1 drugs. Even if I live an unhealthy lifestyle, a powerful new drug will eventually fix it. AI will detect it early, so it's still okay for now. This reliance on technology ironically weakens individuals' preventative awareness. This reliance distances them from the steady and most effective treatment of improving lifestyle habits. However, the aging of blood vessels cannot be reversed like a digital clock. No matter how expensive the medication, it is impossible to restore blood vessels. It is impossible to restore blood vessels damaged by 20 or 30 years of improper management to their original, like-new condition. We may have become overconfident in the shield of advanced medical care and abandoned the sword needed to protect our own bodies. This is not simply a matter of individual responsibility. Stats report suggests that the preventive system for society as a whole is dysfunctional. Much of the medical budget is poured into symptomatic treatment, used after the disease has worsened, and insufficient resources are allocated to education, What's needed to protect the hearts of the younger generation isn't AI predictions or miraculous injections. Knowing your blood pressure, reducing your daily salt intake, climbing one extra step on the stairs. These are the same incredibly analog, incredibly mundane, everyday choices that haven't changed in 100 years. Precisely because it's 2026, we must correctly recognize the limitations that can be solved with medicine. Technology is our ally, but it cannot take the place of your life. Medical advancements are undeniable. However, our way of life hasn't kept pace with that progress. That's the true nature of the contradiction, the worsening of heart disease among young people. Your heart isn't something created in a state-of-the-art lab. It's a living organ that remembers and records everything you ate today, the stress you felt today, and the distance you walked today. In 2026, we stand at a crossroads. Will we become intoxicated by the magic of technology and leave our own bodies behind? Or will we wisely utilize advancements and live as the person most responsible? No matter how brilliant the future of medicine may be, you are the only one in the world who can protect the heartbeat beating inside your chest today. Risi Saizen.